Wonderful. Okay, so you've heard a lot of information. You may have some questions for our experts. We also have people online who might have some questions as well. Do we have one online just to get us started, or? Okay.
There is a question about the 3 must-dos in developing heart strength and thriving. Sort of a summary for the 3 top things to do.
Oh.
I didn't hear.
What was the question again?
So the
Kevin?
question is the 3 must-dos to develop heart strength and thrive. I think this is a wellness question.
Yeah.
Hello?
Yeah.
Okay.
There you go.
So I don't really understand the question, but one thing I'm trying to stress is the importance of eating right and exercising. In addition to the other health metrics, getting your blood pressure controlled, getting your cholesterol controlled, cessation of smoking, and that includes secondhand smoking. So those are the things that clearly have been shown in trials involving millions of patients totally to markedly decrease your risk of heart attack and decrease your risk of an early death.
Okay, thank you, Dr. Scott. We have a question here, and we have a microphone. Where's our microphone handler? Over here? Yeah, right there, in the gentleman in the green jacket, and then, yep.
Yeah, wonderful presentation. Really appreciate this knowledge and information you're sharing with us today. My question is about sleep. I'm 67, and in the last couple of years, I've had naps, required naps in the late afternoon. It sounded like you're talking about that kind of being normal, but how normal is that for? I feel like I get pretty good sleep, but mid afternoon, 3-4 p.m., my body just says you will take a nap. You have to sleep now. Thank you.
So the question is around the afternoon nap, and like I mentioned earlier, with circadian rhythm, things are supposed to slow down a little bit, meaning you're going to have less energy than you did early in the morning, and probably when you hit your second wind in the evening. But that doesn't mean you cannot get through the afternoon without a nap. That means you're more vulnerable to experiencing the sleepiness that comes from not having either good quality or quantity of sleep. So especially if it's a more recent change, I would probably want to find out how long you're sleeping, and I want to ask you some questions about the quality of your sleep. So I wouldn't ignore that.
I don't have a question, but I just want to take this opportunity to thank Dr. Scott for saving my husband's life 6 years ago.
Oh.
I love him, and so does
Okay.
Dan.
All right, wonderful. The mic was in her. She was right there, grabbed it. Do you mind to say?
Pleasure, my job and my pleasure.
Yeah, wonderful, Dr. Scott. Okay, can we get someone from this side here? The gentleman in the 4th row back, trying to mix it up.
Thank you very much. Question, how much water should we drink a day?
Ah, that's it. Okay.
Do you?
Wow.
So if you didn't hear the question was how much water should we drink a day? One of the things I tell my patients is that we as mammals have a very, very, very highly evolved thirst quality. So you should drink when you're thirsty. That's the bottom line. Okay. Forcing fluids, really, doesn't make a lot of sense. And especially patients with congestive heart failure, renal failure, or impaired cardiac or kidney function, they can find themselves overloading themselves with fluid. So you should drink when you're thirsty. And we were evolved to drink water, not Diet Coke or whatever. We were evolved to drink water, not milk either. Okay.
Can you ask about emotional
Okay.
impact
Let's see, in the far back there.
Say, 'cause
Thank you.
that's a good one to say.
You got another one online?
Yeah.
All right. good.
Yes, thanks for putting this on. So my question is actually related to drinking water, especially in the evening and at night. I think if you drink more, then it does affect your sleep quality because you have, for me, I have to go to the bathroom in the middle of the night. So do you have any comments about that as it relates to thirstiness at night?
Yeah, I mean, I agree with Dr. Scott. You want to drink when you're thirsty, obviously, and you don't want to drink most of your daily water after dinner. However, in my career, I've probably had one patient where we solved their sleep problem by just doing that part because he was trying to train and doing excessive water. But oftentimes, waking up to use the bathroom in the middle of the night, more often, given you're drinking the same amount that you've historically been drinking or you're not being excessive, that could be a sign of poor sleep. Sometimes, especially severe sleep apnea can lead to we call the term diuresis, which is excess water. It's your body's way of getting rid of that excess water and pressure. Sometimes you could be waking up for another reason, and then you realize, well, I'm already up, might as well use the bathroom and not void as much. So the idea is you stay hydrated, but not necessarily try to drink more than you normally would do after, especially after dinner, and that can disrupt your sleep.
Okay. We have someone online, online question?
So one question was about the interaction between cardiovascular wellness and community interaction or isolation, which is actually quite a problem in the United States.
Me?
Sorry, Dr. Scott.
Okay, so cardiovascular wellness and isolation, those two really don't mix too well. Clearly, it's been shown that people who are active in their community, be it going to church and having a church group or having some other group to be social and stay active, they tend to do better from a cardiac standpoint. Also, they're less likely to develop dementia. So it really is very important that you are physically active, mentally active, and also socially active.
Yeah, that's excellent. We got a gentleman here in the corner.
Yeah, hi. Thank you again for this wonderful event. I had a question about the sleep apnea. What are the latest best non-invasive treatments for that?
It's a great question. Apnea affects many people. I mean, some data as much as 10%. So you imagine there's a lot of investment in terms of solutions. And over the years, what's happened, CPAP is still the gold standard. There are many treatment options that have come and go. Reality is CPAP has gotten better. It's still the gold standard. It's a lot easier to use, quieter. There's a lot of comfort features that we did not have historically.
What is CPAP? What is CPAP?
Oh, CPAP is a good question. So CPAP stands for continuous positive airway pressure. So it's a machine that has a mask that pushes lightly pressurized air through our nose. It's kind of like air through a flat tire. It opens up the whole airway, and it's 100% effective. There's no significant side effects, and it's covered by all your insurance plans. So it's a great, still first and most effective option. If you're asking about the latest treatment that's sort of stuck around, we probably seen some commercials around, is the Inspire device, which is a pacemaker that connects to the phrenic nerve and wraps around the hypoglossal nerve. The hypoglossal nerve is a nerve that moves your tongue forward, and the idea is we used to think to just move the tongue forward, but it's mostly to tone the tongue muscle to reduce apnea. And for some cases, it can be helpful. It is invasive, so that wouldn't answer your question there. There are, in mild cases, exercises, myofunctional exercises can be helpful for apnea.
So my question for Karen, I want to have yoga, laughter in my life. Should I set an alarm on my phone? What should I do to remind myself to laugh? I don't know. Oh.
Here, she can use mine.
Yeah, there we go. Sorry, we're short on mics.
So you can get good benefit from adding any amount of laughter into your life. And I encourage people just to add laughter to anything you do throughout the day. Washing dishes. One time I was driving down Highway 85. I came to a dead stop in the traffic. I use laughter a lot for stress reduction as the stress management specialist.
Yeah.
And when I'm stuck in traffic, my stress goes way up.
Yeah.
traffic literally not moving, I just sat in my car and laughed. If you do it as a standard practice, if you go to a laughter yoga club, 45 to 50, 60 minutes, people do it at a time. So I just encourage people, add a little laughter to stuff you do every day. Just sit and laugh in your room. And I promise you, people will not think you're crazy.
Well, they already think that of me, so, but anyway, thank you. Can we get a round of applause for our wellness team?